Dear students, welcome back. In the previous session, we have seen the axis of motion, range of motions, and the muscles acting on the radioulnar joint, which comes under the function of the radioulnar joints. Now we are going to see the muscle actions at the radioulnar joint, how these muscles are going to perform its action during pronation as well as in the supination. Okay, now first we will see the pronators. What are the muscles which helps in the pronation? The pronators are the pronator teres and the pronator quadratus. Now, how these muscles are going to work on the radioulnar joints? The pronators produce pronation by exerting a pull on the radius, which causes its shaft and distal end to turn over the ulna. So this is the thing happened here. So as we know that this pronator teres is having two origins. One is the humeral head which is originating on the medial epicondyle, and the another head which is originating on the coronoid process of the ulna, and these two heads are getting inserted on the greater convexity of the radius, isn't it? So now how this muscle is going to work here? So this pronator teres is exerting a pull on the radius, so which is crossing over the distal end of the head of the ulna. So now we will see the force, how the force is acting here. So this is the pronator teres. If you consider this is the action line, if you resolve this force into two components, one is the translatory component towards the joint and another one is the rotatory component. So if you see this thing, this muscle is exerting two functions. So this rotatory component helps in the pronation of the forearm, whereas this translatory component helps in the stabilization of the proximal radioulnar joint in such a way that the head of the radius is kept in contact with the capitulum. That means it is exerting a compressive force. The translatory component of the pronator teres helps in the compressive force to maintain the proximal radioulnar joint in contact with the capitulum. Now this rotatory component of the pronator teres is the actual pull of the radius, which causes its shaft of the radius. So which causes the shaft of the radius to turn over the ulna, So this is the thing happening here. So this is the muscle action of the pronator teres. Okay, now coming to the pronator quadratus. This pronator quadratus is a one joint muscle. That means it is not crossing any two joints. It is crossing only one joint muscle, and it is also not affected by changing in the position of the elbow joint. Okay, and this pronator quadratus is active in both unresisted as well as a resisted pronation, in slow as well as fast movements of pronation. And it is also having two heads. One is the superficial head and the deep head. Mainly the deep head of the pronator quadratus is active during both resisted supination as well as resisted pronation, and this muscle is considered as a dynamic stabilizer to maintain compression of the distal radioulnar joint. And some of the studies called mechanical studies on the cadavers, they have found that the pronators were most efficient around the neutral position of the forearm, that is when the elbow is flexed to 90 degrees. An investigator called Bremer in another study on cadavers determined that the pronating effect of the pronator teres is determined that teres as well as the pronator quadratus is maximum between 40 degrees of supination and 40 degrees of pronation, and it is going to be decreased during its declination of its extreme position. That means at the end of the pronation, the effect of this pronator quadratus and the teres is going to be decreased. But the maximum effect of these muscles can be seen at the 40 degrees of supination as well as 40 degrees of pronation, both in the case of supinators also. Okay, and some other studies who by name called Gordon and colleagues, in which the supinators and pronators were tested in the absence of gripping. So as we studied that some of the muscles which helps in the gripping, that is the muscles which are placed on the lateral and medial aspects of the both on the flexor side as well as the extensor side. So here they have removed that gripping function, and they have seen that the supinators and the pronators were tested again as resistant. No significant differences were found between the supination as well as pronation torques with the forearm in neutral positions. However, supination torque generation was greatest with the forearm in pronated positions, whereas the pronation torque generation was greatest with the forearm in the supination position. Okay, these are all about the pronators. Now we are going to see the supinators. The supinators also, like the pronators, which act by pulling the shaft on the distal end, pulling the shaft of the distal end of the radius over the ulna. So how the supinator muscle is going to act now? The supinator muscle may act alone along the unresisted slow supination in all positions of the elbow or forearm. That means here the supinator is the single muscle which are going to act on the shaft of the radius in all positions of the elbow or forearm, whether the elbow may be extended or flexed or semi-flexed or in neutral position, or in all positions of the forearm, means it may be the forearm may be in mid-prone position or fully supinated position or in fully pronated position. In all positions of the elbow and forearm, the supinator is the single muscle is going to act in unresisted slow movements, and it is having a capacity not only in unresisted slow motion, but it is also performing some effect when there is an unresisted fast supination when the elbow is extended. When the elbow is extended, so the supinator muscle will act during fast supination also, that too unresisted. And as we know that not only supinators, the biceps is also having some effect in supination. So here the bicep acts as a synergist to that of the supinator. How this biceps is going to help this supinator? Okay, so now we'll see the activity of the biceps. So this biceps action is evident when the supination is performed against resistance, and also during fast supination when the elbow is flexed to 90 degrees. So in the previous activity of the supinator, we have seen that the supination of the forearm is done in unresisted way. The supinator muscle is going to act, and also that too slow one. If the same supinator is acting unresisted fast supination when the elbow is extended. So in these two conditions, the supinator muscle is very active. When this biceps is going to involve in this supination means when there is a resisted movement occurs, then the activity of biceps is involved. And also during fast supination, especially when the elbow is flexed to 90 degrees. In these two conditions, the biceps is going to help the supinator muscle. Okay. Now, as the forearm moves into pronation, the biceps supination torque increases and reaches a maximum at about 20 degrees of pronation. At 20 degrees of pronation, during resisted motion, the supination torque of the biceps is maximum. Okay, along with the supinator muscle. Next, some of the studies like Bremer found that the momentums of all major supinators. So, all major supinators are nothing but the supinator as well as the biceps brachii. So, what is the thing happening? So, these two major supinators exhibit peak torque values in 40 degrees to 50 degrees of pronation. And also, the biceps brachii has been found to exert 4 times as much as supination torque with the forearm in the pronated position than with other forearm positions. That means the biceps is exhibiting maximum supination torque when the forearm is in complete pronated position. Okay. And they have also found that a mean maximum supination torque is 16 Newton meters were recorded with the forearm 75% pronated in comparison with the mean maximum supination torque, that is 13.1 Newton meter for neutral position when the elbow is at 45 degrees of flexion. Okay, that means what? The biceps is exhibiting more supination torque when the forearm is pronated at 75% of pronation in comparison to when the elbow is flexed at 45 degrees and it is showing only 13.1 Newton meters of supination torque. Okay. Now, the another muscle, that is the anconeus muscle, is active in supination and pronation, but it is having what you called a role in the elbow complex is the stabilization role, and this can be explained in the stability of the elbow complex. Okay, some testings have done like isometric testing. The supinators are stronger than the pronators. Okay, so these are the things or explained under the supinators. If you see the action of the supinators, so if you can see the force, so this is the force of the supinator. That is the action line of the supinator here. If you resolve the force into two ways, one is the rotatory component and the translatory component. So the translatory component of the supinator causes or pull back the shaft of the radius into its normal position over the ulnar head. And also here the action of bicep, if you can see the insertion here, then the long head, mainly the long head of the biceps, which is crossing these two muscles, two joints, which is having only less effect at this elbow joint, and the short head of the biceps. So the action of combined action of these two biceps brachii. So this is the action line, and if you resolve this into the forces, so it is also performing maximum rotatory than the translatory forces, so which helps in the supination. If you consider this force also, it is having maximum supination torque than the elbow flexion. Okay, so these are the things happening in the case of supinator. Okay, in the next session we are going to see the stability of the radio-ulnar joint. As you people know that the stability of the proximal ulnar joint and the structures which are associated and the ligaments and the capsule which are associated with the proximal radio-ulnar joint are going to give some stability on the proximal radio-ulnar joint. And also some of the studies had been done on the distal radio-ulnar joint, and what are the muscles which are going to give support, and also the other structures which are related to the distal radio-ulnar joint, which give stability both in static as well as in the dynamic conditions. Those things we are going to see in the next video. Thank you.